So again, one of the common questions that people ask around self-injury is what is it that leads people to feel so awful inside that hurting their own body actually feels better? And while you can never say there's a direct cause between one experience and self-injury, because everybody copes with things differently and it depends on the context that they're in, there certainly are common experiences which many people who hurt themselves have, and these include things like neglect, physical, mental or sexual abuse, either in adulthood or childhood, bullying, experiences of loss or grief or bereavement, any kind of trauma, and also experiences that people talk about less, but things which are hugely significant are things like institutionalisation. So when people find themselves in a psychiatric hospital, a care facility, a prison, a facility for people with disabilities, for example, there's a very significant relationship between that sense of being incarcerated somewhere and self-injuring being one way of dealing with that. And all of those experiences are things that cause people terrible turmoil, cause emotional pain, they cause a sense of identity confusion. And often they're also experiences that are really stigmatised. So if we think about how we are as a society, it's very difficult for people to talk about the experience of being bullied, being neglected or abused, because we live in a world where somehow that's seen a reflection of that individual, not the people or the situation that's hurting them. So all of those things then become internalised, and self-injury can be one of the few ways in which people can actually try and express or work through or make meaning from those experiences.